Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Ms. Erica Daulton, who is a cancer risk navigator with Baptist Health. Welcome.
Thank you, Dr. Fox, for having me.
Now, we're going to get into cancer risk here in a little bit, but Baptist also has a breast cancer awareness walk coming up. Tell us a little bit about that.
Yes, we do. We're very excited. Our breast cancer walk this year is going to be out at our new Hamburg facility. So we're very excited to host everyone out at Hamburg. It is October the 19th at 9 o'clock in the morning. It is rain or shine. So we are excited to celebrate our survivors, provide a lot of education and be able to answer questions for anyone who comes out and wants to learn a bit more about risk assessment, a bit more about how to sign up to get a mammogram. We're going to have a lot of giveaways, a lot of tables, a lot of food. So we're excited to host everyone and looking forward to it.
Well, now you mentioned cancer risk. Let's do breast cancer. Is there specific risk for breast cancer?
There is. I think every woman in the general population has a risk to develop breast cancer, and that's about 12%. And because of that, it's important for women to make sure that they're undergoing their annual screening with their mammograms, but it's also important for women to understand if they're at higher risk to develop breast cancer. You can have a higher risk to develop breast cancer based on family history. So it's important to understand first and second degree relatives and if they have developed breast cancer, and to share that information with not only your provider, but also to share that information when you're scheduled for your mammogram.
Well, now, that's for breast cancer, but are there general things that affect cancer risk?
Sure. Family history can impact your risk for all different types of cancer. It's also important to make sure that you're controlling your environmental exposures. So, for example, we know that smoking can increase the risk for certain types of cancers. We know that poor diet can be an increased risk factor for certain types of cancers. And again, as we age, our risk for cancer increases as well. So including and trying to control and understand those risk factors, putting them all together is important for talking with your provider about how best to reduce your risk. And then it's important to know how best to screen to make sure that if you do develop cancer, that we're catching it as early as possible.
Well, now, since you are a breast cancer risk navigator, there's some tools that you can use and maybe make them a little bit more specific for the person in terms of their own personal risk of cancer?
Yes, we do. So we're very excited at Baptist. We launched a new program over the summer through our mammography centers, with the intent to ensure that we were identifying women who have an increased risk for breast cancer. So if you have your mammogram at Baptist, you're going to receive electronically via text or email a questionnaire. And we're going to ask you about your family history. We're going to ask about personal history, personal factors as well. We're going to utilize the answers to your questions to determine if you have an elevated risk for breast cancer. We want to be able to educate our patients and make sure that they're receiving the appropriate types of screenings at the right age and at the right intervals.
Now, you mentioned that with I think I heard you say mammogram, but can you access that tool other ways?
Typically you can. There are ways online where you can look up ways to assess your breast cancer risk. Most providers will also ask you the types of questions to help estimate your lifetime risk to develop breast cancer. One of the things that's important is to understand, I mentioned that women in the general population have about a 12 to 13% chance to develop breast cancer. Once a woman's risk reaches 20%, it becomes reasonable to have a discussion with your provider about adding breast MRI into your screening program along with mammogram.
Well, are there anything specific to Kentucky?
So one of the things that's new in the state of Kentucky is that you will now receive with your mammogram report if you have dense breast tissue. That becomes important because women who have dense breast tissue have a slightly higher risk to develop breast cancer, and in addition, it can be a little more difficult through mammogram to visualize the breast. So often women who have dense breast tissue may need to think about having a discussion about breast MRI. And so now, every time you receive a mammogram, in your mammogram report, you will know if the radiologist feels you have dense breast and may need to talk to your provider about additional types of screening.
That's great information. We appreciate you coming in. And right before you go, tell us the breast cancer walk dates and times again.
Yes, it is October the 19th at 9 a.m. at the new Baptist facility out in Hamburg. So rain or shine, we're excited to have everyone and come and learn a little bit more about breast cancer screening and take away a lot of goodies.
Well, we appreciate it. Thanks for coming in and talking to us.
Absolutely. Thanks for having me.
We'll be right back.